Medical advancements in the U.S. are impressive. Sophisticated diagnostic equipment, new technology in operating rooms, medicines that cure once fatal diseases. It is hard to believe that in the 21st century, so many of our neighbors to the south, just 2 hours by plane, have never seen a doctor or an aspirin. Here in remote regions of Honduras, millions die of easy-to-treat illnesses.
Then people in those remote areas are dying from some treatable disease like parasites, like injuries, like women in the process of delivering, and some other preventive disease in this area. One of the reasons that we don't have access to the healthcare in those areas is because we are not in the priority and the agenda of the government. Then you can see the condition of the bad road to access to this area. Even the bad condition, if you want to get the patient from here to the outside, maybe 8 hours to get access to the most nearest hospital. Then you can see we don't have electricity, we don't have access to television, we don't have access to internet, even lack access to, even for cell phone.
In the 1990s, a California labor organizer exploring Honduras encountered villages of Garifuna people. They are descendants of a mix of Africans and indigenous Caribbean Indians. The distinct ethnic group managed to survive in Central America with their own language, music, and culture intact since the 17th century. Seeing a medical need here, the union organizer formed the nonprofit California Honduras Institute for Medical and Educational Support, or CHIMES for short. CHIMES organizes humanitarian medical missions to Garifuna villages and helped build their medical center.
And what we do is bring down the money for the building materials to expand this medical center and medical teams, the doctors and their support staff who bring medicine is vital to the success of this hospital. They also go out into the outlying communities sometimes as many as 2 days from where this medical center is. Our job is to try to support the work being done by the Honduran doctors.
Teams of volunteer medical personnel from the U.S., Cuba, and Honduras convene here. This unusual partnership takes an integrative approach. They work alongside the locals in a respectful way, sensitive to their culture. The Cuban government provided hundreds of Hondurans with full scholarships to study medicine in Cuba. They returned to their villages as medical doctors.
What's unique about CHIMES is it brings together Honduran doctors who've gone to medical school both in Honduras and some in Cuba, many in Cuba, plus Cuban doctors for American doctors. They come together and form these joint teams. And then we go from this neighborhood here all throughout the more rural areas in the jungle that within 1 or 2 days travel from here. Many of this effort is to check everybody in a neighborhood, in a community. So we build a medical record for everybody in the community that nobody else in the country is doing.
The Honduran government is not able to provide clinics or care to remote communities, so CHIMES helped open the first medical center in 2007 in Saraboya, an isolated Garifuna coastal village in the north. They raised $50,000 in the U.S. to purchase the building materials and brought donated medicine. Cubans provided the medical equipment. Under the guidance of a skilled foreman, the Garifuna Medical Center was built by the locals. Everyone pitched in laying the foundation and building the structure. The modest facility was opened in a year, with great community pride and fanfare.
We brought the solar panels down, and then the Cuban engineers installed them with the help of the community, and it's a pretty good example of how a community can come together and make a project work.
The first Garifuna Popular Hospital located in this area is the first hospital in Garifuna community in 214 years. Is becoming the alternative model of free healthcare to the poorest of the poor who are living in this area. Thanks to the people from this community who help us to build, and thanks to our friend from CHIMES, and specifically our friend Bill Camp, who helped us in the process of building this beautiful center, a symbol of dignity.
Garifuna Medical Center staff treat patients lined up from local and distant villages. None can afford health care. From the initial intake interview to doctor evaluations and consultations, lab tests, diagnosis, and treatment, everything is free of charge. Prescriptions are written for necessary medication, including over-the-counter remedies dispensed here in the pharmacy. Medicine is also provided without cost to the patients.
We treated more than 700,000 patient visits here at this medical center and the outlying clinics that were established through this center that treat patients in their home communities. That's been a huge success, and it's the donated medicine that really makes a difference for the success of the health of these people.
How to develop a medical care delivery system for people in remote jungles and barrier islands. This is the subject of a 10-day international health conference hosted in a Garifuna village for the medical teams.
The different cultures and different ideologies and different kind of mindsets of people. We have the faith-based organizations, we have the Cuban doctors coming out of a socialistic kind of concept, American doctors coming out of private enterprise concept, and the Honduran doctors that are willing to assimilate both of these into this clinic here. The example would be one, we had a man come in with a deep cut on his left hand, went through the tendons. Normally in America we'd have sent him off to a major hospital. Here, the Cuban doctor and one of our local emergency room people were here. They cleaned it up, sewed it up. The Honduran medical students watched. We all thought it was going to be a catastrophe. The next day the man came in with a full range of motion.
We frequently go to villages which are very remote, sometimes 10 or 12 hours from the nearest hospital of any sort, and we see and treat patients which can be critically ill. One of the hard parts of it is that we don't know any follow-up. We do what we can there, and we leave instructions and we leave medication, but we never know what happens to these people.
For CHIMES, our first main goal is to build a surgery center here. It's more than 2 hours on really rotten roads to get to a place where we can have surgery done. Our second goal is to build a dormitory that American doctors, people who are doing their residency, could come to Siraboya and get an international experience in medicine. And we've had some interest by Kaiser in participating in this. But our fundamental objective is to help the Garifuna build a medical center that works for this whole region.
Out of compassion, people from disparate cultures and countries will cooperate to build healthy communities. For more information, visit CHIMES Project at chimesproject.org.